Did you know that many practitioners, including GI specialists, are still using outdated methods to diagnose gut issues like SIBO? If you've been told to take a stool test or a 2-hour breath study, you're definitely not getting the full picture. Today, we're diving into why the 3-hour SIBO breath test is the gold standard for diagnosing bacterial overgrowth, how you can skip the hospital lab testing and test from the comfort of your home, and how to make sure your results are as accurate as possible. If you're looking for real answers to your gut health struggles, this is the video for you. Hi, I'm Dr. Michael Arthur, otherwise known as the Mind Belly Doc, and welcome to the channel where we tackle gut health issues with IBS and SIBO with clear, actionable advice. If you've been dealing with symptoms like bloating, constipation, diarrhea, or just feeling off, you might have heard about testing for SIBO. But here's the thing. So many well-meaning doctors are still recommending stool tests or incomplete breath studies, which often lead to misdiagnosis or missed diagnosis. Get my drift? That's why today I'm breaking down everything you need to know about the 3-hour SIBO breath test and how you can order one to do right at home. I've even linked resources in the description below so that you can get started today. Let's address the elephant in the room: stool testing. While stool tests are great for diagnosing certain gut conditions like parasites or infections in the large intestine, they completely miss what's happening in the small intestine, the part of your digestive tract that's usually affected by SIBO. Stool tests just can't detect the bacterial overgrowth causing your symptoms. Even the stool studies that will report on, Methane-Producing smithii, or will report on other usual pathobionts like H. pylori. Even if they're elevated on stool studies, that doesn't necessarily mean that you have SIBO. So buyer beware when you're working with a practitioner that says, oh yeah, we can just diagnose that with a stool study. No, you can't. Instead, the breath test that we recommend for in-home use will measure the gases that are actually produced by the pathobionts responsible for SIBO, EMO, and even ESO. Remember, SIBO can be hydrogen gas only or can be mixed hydrogen and methane, while EMO is methane only and ESO features hydrogen sulfide gas production. ESO can also have hydrogen and methane gases. I know, complicated. And in my clinical experience, it usually has overproduction of one or both to go along with the hydrogen sulfide gas. Now, there are 2 kits for home use that we most often recommend. First up is the Genova Diagnostics kit, and the second is the Gemelli Biotech kit. The Genova Diagnostics kit only measures hydrogen and methane, while at the time of this taping, the only test to measure hydrogen, methane, and hydrogen sulfide comes from Gemelli Biotech. This is how we pinpoint bacterial overgrowth specifically in the small intestine. So if someone's recommending a stool test to diagnose your SIBO, you might want to pause and rethink their well-meaning but misguided approach. The 3-hour SIBO breath test is the gold standard for a reason. Let me say that again. 3 hours, not 2, is the gold standard for a reason. Most people have a 2-hour transit time through their small intestine, but methane-dominant overgrowth, or EMO, can occur in both the small and the large intestines. And that means that the extra hour provided by a 3-hour test is critical for detecting methane-producing organisms that might otherwise be missed if you just stop short at the 2-hour mark. Unfortunately, many doctors, even GI specialists, still recommend 2-hour tests or don't offer breath testing at all because traditionally these tests were only available in hospitals or monitored settings. Having a nurse keep up with breast samples every 20 to 30 minutes for 3 hours takes a well oiled machine, and with the hustle and bustle of most clinics and hospital systems, there's just not many practices or hospital systems equipped to do it. Think about it. This takes our nurse out of commission for 3+ hours and gives that nurse little time to attend to other things in the day. But here's the good news. We have excellent at-home testing options available through labs like Genova Diagnostics and Gemelli Biotech. And you don't need to go to a hospital or a clinic anymore. You can complete the test in your own home, and I've linked resources in the description below to help you order your kit through our Rupa Labs store. Here's how the testing works. You'll drink a sugar solution, either glucose or lactulose. I personally recommend lactulose because it's not absorbed by the gut, making it more reliable for detecting overgrowth in both the small intestinal and large intestinal chambers. The Genova kits come equipped with lactulose already, while the Gemelli Trio Smart has glucose. So if you order the Gemelli kit and you want to use lactulose, you'll have to get a prescription from your doctor to dispense 15 milliliters of lactulose solution from your local pharmacy. Now, every 20 to 30 minutes over a 3-hour period of time, you'll collect breath samples by blowing into a specialized bag and then popping on a sealed glass tube to that bag. Your breath will flow from the bag to the tube and get collected for analysis. These samples are sent to the lab where they're analyzed for elevated levels of hydrogen, methane, and in case of the Gemelli Biotech, hydrogen sulfide. Now, each gas tells a unique story about what's happening in your gut. Hydrogen gas is linked to diarrhea-dominant SIBO usually. Methane gas equates to EMO and usually means constipation. A mix of hydrogen and methane gas is still considered to be SIBO, and you guessed it, most patients with mixed SIBO can vacillate between loose and hard stools without any rhyme or reason until now. Hydrogen sulfide gas equates to ESO, or intestinal sulfide overproduction. This unique gas is only tested by the Trio Smart kit from Gemelli Biotech at the time of this taping in early 2025. Now, the presence of this gas helps to explain symptoms like bloating and systemic toxicity when other gases appear to be normal. If you frequently feel like you're toxic, you're sore, or you're coming down with something, or maybe you've already done a SIBO study and was told that it was negative, then you probably should confer with your doctor to get a lactulose prescription and consider doing the Trio Smart testing to look at all 3 gases, because hydrogen sulfide is easy to overlook. Now, folks with ESO usually have predominant diarrhea too. Proper preparation is critical for accurate results, and the devil is certainly in the details here. Our patients often tell us that the preparation for the test was harder than the testing itself. No matter what kit you choose, you will need to modify your diet the day before testing. This means that 24 hours before the test, you'll be on the blandest and most boring diet known to humankind. But that's okay, it's just for a day. During those 24 hours, you'll be asked to stick to plain proteins, white rice, and clear meat broth, all while avoiding fermentable foods like fruits, veggies, and grains. The dietary recommendations restrict you from even cooking with herbs. We're talking plain old salt and pepper, and that's it for flavoring your food. As you can see from our slide, you can have meat, chicken, turkey, fish, or seafood, but those meats cannot be cured or brined. That means deli meats are out the day before testing. You can have plain white rice. Just make sure it is white rice, as brown rice or wild rice will give you false results on your testing the next day. Eggs. Eggs are a-okay. Cook them however you like, except as an omelet, because you'll notice that the only dairy allowed is butter. Absolutely no cheese, no milk, no cream, or yogurt the day before testing. Broth is tricky the day before testing, but as long as you stick with clear meat broth that has no bones or cartilage used for making the broth and has no vegetables used for making the broth, then you're sticking to the rules. The clear or easy takeaway here is that you need to stick with a broth and don't confuse it with a stock. Even though we use the terms broth and stock interchangeably, stocks are actually made from animal bones usually, so avoid stocks. Lastly, you can see that we want to stick with plain water. That means no mineral waters, seltzer waters, or other waters that contain additives. You can have coffee and black tea, but please avoid herbal teas, green teas, and of course, no sweeteners or creamers. I know, again, blandest diet known to humankind. Now, in addition to those bland food guidelines before breath testing, there are also specific medication and supplement guidelines. Here are your medication guidelines. For 14 days before collection of your breath samples, stop antibiotics, antifungals, probiotics, and natural antimicrobials, including Pepto-Bismol. For 7 days before collection, you'll want to avoid using the following medications listed on our slide. These include laxatives, think Dulcolax and Miralax. This includes stool softeners. Dulcolax is on that list once again, along with Colace. Stool bulking agents, think Citracel, Metamucil, Fibercon. Antacids containing aluminum. Gaviscon is our primary example here. Magnesium hydroxide. Now, if you feel that you just can't get along without some of these agents typically used for your constipation, then please consult with your doctor about their continued use or for suitable alternatives to use over the week before testing. After your 1-day prep diet, you'll enter into a period of fasting. Both the Gemelli test and the Genova breath test ask that you stop eating and drinking 12 hours before the test. Of course, water is fine to continue to stay hydrated in preparation for your testing. Now, on the day of the test, you can brush your teeth, but don't swallow the toothpaste or use mouthwash. Avoid smoking, exercising, or napping because all of these things can interfere with your results. Avoid gums and candies as these can interfere with results as well, especially if they are sugar-free candies or gum. Now, if you're thinking, why all the fuss about the preparation? Here's why. Improper preparation can lead to false positives or negatives. I've seen patients waste a couple $100 on a test only to get inconclusive results because they didn't follow the prep guidelines, particularly that bland diet. Now, you don't want to be one of them, so follow the instructions closely, and if you're still unsure about anything, you can ask your doctor or the lab for clarification. If you order from Rupa Health, they have a wonderful support staff that can answer testing and prep questions for you. Now, once your results are in, your healthcare provider will analyze the gas levels and patterns. If you're part of the Mind Belly Blueprint program that we offer, we can help you analyze those results as well. But as far as tests go, the test results that are provided for you are some of the easiest to read and to understand. I find that they are easier for patients to understand than even routine blood work. Now, once you know what gases are present and where they are present, you should know about breath testing. We cover it in the Mind Belly Blueprint. The test is not only diagnostic of SIBO and the type of SIBO that you have, but it is also prognostic, meaning that based on the amount of gas being produced, you can estimate about how many rounds of treatment you are likely to need to lower the overgrowth in your intestines. SIBO is not like a UTI. It's not an infection. Infections imply that the bacteria that are present, they're not supposed to be present. But with SIBO, the bacteria or archaea that are present, they are supposed to be in the GI tract, just not to the extent that they are colonized and being expressed. It truly is an overgrowth or an overabundance, and we treat it differently than we do bronchitis, pneumonia, or UTIs. The vast majority of patients with SIBO are not one and done. It's not always as simple as here's your 7-day course of antibiotics and you're going to be as good as new, like we're accustomed to with the UTI. Healing from SIBO, EMO, or ESO takes time and perseverance. Are you ready to take control of your gut health? You don't need to wait for a hospital or clinic to offer these tests anymore. At-home kits from Genova Diagnostics and Gemelli Biotech are game changers for making the process accessible and convenient. Check out the links in the description below to order your SIBO breath test kit through our Rupa Lab store, and you'll get everything that you need to complete the test at home and send your samples off for analysis. It's really that simple and convenient. The 3-hour SIBO breath test is a powerful tool for uncovering the root cause of your gut symptoms, but its success depends on accurate preparation and choosing the right test for your unique belly situation. If this video helped you understand the process, please give it a thumbs up, hit that subscribe button, and share your thoughts in the comments below. Have you ever had a SIBO breath test? What was your experience? Now, don't forget to check the description for links to order your test kit and take the first step toward healing your gut. Remember, understanding your gut is the first step to transforming your health, because all health, good or bad, begins in the gut. Until next time, be well.